Nebraska's Department of Health and Human Services reports 100,000 people in the state are living with diabetes, and I guess thousands more have not been diagnosed yet.
One of the warning signs is tingling or numbness in the feet, and what seems ordinary can sometimes lead to very serious complications.
Yeah, and that's where Dr. Brad Copple comes in. He's a surgeon at Miller Orthopedic Specialist. What kind of surgeon are you, doctor?
I am a podiatric surgeon.
So feet and ankles.
I specialize in the foot and ankle.
So what's your main goal at Miller? And I guess you know, how do you treat these type of cases?
Well, I've been with Miller Orthopedic for about a year now. There's a total of 9 healthcare providers in the group, and we cover 12 different locations in the greater Omaha, Council Bluffs, and southwest Iowa. Myself and another doctor, Dr. Panisar, make up the foot and ankle team, and I treat really everything from the foot and ankle, from bunions, hammer toes, fractures, but I have a special interest in diabetic limb salvage and wound care.
And for our viewers who maybe you know that having diabetes can sometimes lead to foot and ankle problems, I think the pictures really demonstrate that well. And these are not extreme cases, what you brought to show us today. Would you walk us through these images?
Yeah, absolutely. The pictures I brought are pretty tame.
Well, this is a little graphic from my standpoint, because I was shocked to see this type of damage done to the foot through diabetes, but this is, like you said, this is a tame picture. What are we looking at here?
Well, what we're looking at the bottom of 2 different feet, and those are classic diabetic ulcers. What you alluded to, the numbness and tingling in the foot, is called neuropathy, and that's typically seen in patients that don't do a very good job with their blood sugars, and the small nerve fibers in the bottom of the foot waste away. Then what happens is that part of the foot just inherently is absorbing more pressure and friction, and they'll develop a callus. And someone who has good sensation, they'll walk along, they'll change the way they walk to alter and take the pressure off that area without even thinking about it. But people with diabetes and neuropathy, they go along as business as usual, and then the skin underneath there will break down. And anytime you have an opening that you're not supposed to have, it's a portal for bacteria, and that's when it can get infected, and that's when bad things happen.
And we've heard about amputations, just sort of cycles, right?
Yeah, then that's what you want to avoid, is just sort of whittling away at somebody.
How common is that? Is that through somebody not managing their diabetes correctly?
That's a big part of it. Controlling their blood sugars is the most important thing, not only for their feet, but for their eyes, their heart, their kidneys, etc. That's why, being a diabetic, you need to monitor your blood sugars daily, check your feet daily. If you ever see any cuts, sores, blisters, anything that wasn't there before, you need to go see somebody about it right away. You don't want to monkey around with these things.
So don't brush it off and think, oh, that's nothing?
No.
Be hypersensitive about it?
That's absolutely right.
So that's the prevention part of the picture. Any unique treatments available at Miller?
Yes, one thing that you mentioned with the reptiles there was stem cells. In the past, what we've done to cover these wounds was use a skin graft. And skin grafts work very well in other parts of the body, but they traditionally don't work very well on the bottom of the feet.
Is that because of all the, I guess, the friction, because you're walking on it?
Yeah, and you're taking skin that's different. Skin from the leg or the back or wherever. When you put it on the bottom of the foot, that skin on the bottom of the foot is 20 times thicker. So what we've developed is a newer product out there that is harvested from a newborn foreskin. And they harvested this foreskin many years ago, and they grow it out in the cell line in a lab, and then you use that as a skin graft substitute, so you can stimulate them using stem cell technology to grow their own skin.
And that's available in Omaha today?
That is
available.
This
isn't 20 years from now.
Nope.
This will be available now.
Nope. We do them every day.
Isn't that incredible?
So we did learn some things from the reptiles.
Yeah.
I know, we were half joking there.
I know.
But it's legitimate.
We haven't figured out how to grow a new leg yet, but maybe someday.
Do our viewers, if they're saying they've got their family physician, is that the person who needs to refer them to you? Or if what you were saying rings true, can they just give you a call directly?
Yeah, absolutely. They can just give my office a call and make an appointment. or go to our website, millerortho.com.
It's a great website. Some resources available there online. I was bumping around, learned some things, learned about you and where you've been to school and all the rest. I wasn't stalking you, I promise. It sort of sounds that way, doesn't it? Miller Orthopedic Specialists in Omaha at 162nd and Maple on the south side of Maple there. And again online, it's millerortho.com.
But doctor, like you said, you really can't stress the point enough. You have to manage the diabetes because it really is a serious disease.
And does it matter type 1, type 2?
Well, the type 1s are generally better controlled because they've had it longer, but type 2 are traditionally what we see develop with the foot ulcers. Not exclusively, but that's typically what we see.
So with those foot ulcers, there are treatment options. I guess that's another point.
There are treatment options, and the biggest thing is don't neglect this. The mortality of a diabetic foot ulcer is 2.5 times that of breast cancer.
Oh, wow.
And so really, diabetic foot ulcers it's an under-recognized problem in healthcare.
Be an advocate for yourself, but technology's there too, as we've learned today.
Yeah.
Thank you so much. It's nice to
Very
meet you.
interesting.
Yeah, you too.
Thanks a lot,
Thanks.